James Smith is a lecturer in Humanitarian Policy at UCL with significant experience as an emergency doctor in Gaza, and he joins us live now from Paris. Welcome, James. So we're just hearing from Ashraf there just how terrible the situation is currently in Gaza. Can you talk us through just how much extra medical care is needed right now at this stage in Gaza as the people there suffer what is, as it's been described by the World Health Organization's director, a man-made mass starvation?
I mean, this is a dystopian catastrophe entirely manufactured by the Israeli occupation. As we listen to Ashraf there, we can hear the drones circling overhead. I mean, it is the most horrific situation that Israel has been permitted to create in Gaza. The health infrastructure is barely able to respond. We now, of course, have a growing number of starvation-related deaths at the same time as people continue to be killed from shots fired by Israeli soldiers, Israeli airstrikes, and Israeli warships. The volume of immediate humanitarian assistance that is required in Gaza simply to stave off death from one day to the next is phenomenal now. And most of that aid, if not all of it, is sitting across the border in El Arish and could very quickly, within a matter of hours, with the political will, make its way into Gaza and reach the people that most urgently need it.
And James, as Ashraf has been reporting, we've seen deaths every day this week, children, babies. What are the long-term effects of malnutrition if these people who are so starving do manage to survive? What are the long-term health effects there?
I think the first thing to make very clear is that malnutrition is relatively easily treatable. There are very straightforward and safe interventions that can be used to treat acute malnutrition. And those resources, again, are available just across the border and just across the armistice line and are being denied access into Gaza. There is a period in the first 2 years of life where nutritional support is particularly important to stave off long-term cognitive and physical problems. But of course, any child that has experienced malnutrition at any point in their growth and development will experience longer-term consequences. And we know by virtue of Israel's protracted occupation and deprivation of food that long predated October of 2023, that many children in Gaza were stunted, had experienced chronic undernutrition, and therefore had growth and development related problems as a result of that deprivation of food. So this acute starvation now will absolutely have long-term effects on absolutely everyone that has been affected.
And James, we are hearing news now that France has plans to recognise the state of Palestine. You, of course, were in France meeting officials on this and looking to try to convince more nations in Europe to follow the same path. How do you think that's going, and is it likely we'll see other countries follow what France is doing?
What we've seen over the last 2 years and of course much longer is a complete lack of moral and political leadership from many of the states worldwide, and certainly those that have the power to change the course of what Israel is doing to the Palestinian people. France has taken a significant step, and I would expect that they are hoping that several other states will follow suit, the UK and so on in particular. It appears to me that many states are really afraid of potential repercussions from the US administration, but also from Israel itself. And of course, what's needed now is a unified front of not only rhetoric of concern, but serious political action to avert an even deeper catastrophe. This is, of course, genocide. You can't appeal to the benevolence of genocidaires. You need to intervene to protect those people against whom genocide is being perpetrated. And that's what is needed most urgently now.
James Smith, lecturer in Humanitarian Policy at UCL, thank you so much for your time with us.